Hi, I'm Dr. Eric Westman with Adapt Your Life, and I'm here with Katie Newman.
Correct, yeah.
We just went through Adapt Minnesota, and thank you so much for all your work in putting Adapt Minnesota together.
Oh, you're welcome. It was my pleasure. Like I said during my presentation yesterday, it was like a dream come true to finally bring ketogenic education to my community. Yeah, it was so heartwarming, and I'm still like touched and filled with gratitude, and I probably will be for weeks and months to come.
It's pretty amazing getting 200 keto crazy people together in this same room.
It just feeds me. Yeah, it energizes me and keeps me going. Yeah, it was a great experience.
Now, tell me a little bit about what you do, your practice.
Yeah.
Are you seeing patients? And
So I am a certified personal trainer. I'm a certified nutritional therapy practitioner, a holistic lifestyle coach. I also teach fitness classes and Pilates, so I have a whole realm of things that I do. And I've been in this field for 20 years, so I've seen it all. Back 15, 16, 17 years ago, I had a lot of clients coming to me saying they were doing Atkins, and unfortunately I was kind of skewing them in the wrong direction. Although at that point in time I knew that the guidelines, the calories in, calories out model did not work. So I was always searching for the answer. And when I found keto 4 years ago, the light bulb went off and I was like, this is it.
So you had during your talk yesterday, you had a pretty amazing story about your own transformation. Would you mind sharing a little bit about that?
Yeah, definitely. So I found keto as literally my last-ditch effort to get well, because I couldn't find anything for the past 2 decades. I kept continuing to get sicker and sicker.
What sort of things were you
autoimmune diseases, Hashimoto's, Raynaud's, eosinophilic esophagitis, autoimmune disease of your esophagus.
Yeah, that's not a very common thing, I have to say, being an internist. And so what kind of symptoms does eosinophilic esophagitis get?
Yeah, so it's usually referred to as a choking disease. So some people do choke. They'll choke on their supplements, they'll choke on their food, they'll get food caught in their throat. But I wasn't a typical case. I had profuse vomiting and severe stomach pain. And so it was hard for them to diagnose at first.
So did you go to specialists?
Yeah, I was very sick for a long time. I lost a lot of weight. It was very traumatizing. And I figured that out myself, with Dr. Google, luckily.
Well, you can't do your own esophageal biopsy.
No,
right?
no, and actually...
Did you go to a doctor and say...
Yes, I finally convinced the doctor to give me a biopsy just to confirm what was going on. And then I was diagnosed, and the GI doctor said I was the worst case he's ever encountered. I actually jumped off the table when he did my biopsy, and he said, "You're not supposed to feel that." He's like, "I've never had a patient feel my biopsy." So I was pretty inflamed.
You met a doctor who would do that. Most doctors in my area probably wouldn't do biopsies based on someone, unless, if you had symptoms that really weren't getting better. So, wow, but now that's improved? Yeah,
well, so I knew that going low carb and grain free made me feel better, so I found Maria Emmerich's website, and I decided, okay, I'm just going to dive in. And literally within 2 to 4 weeks, all my symptoms subsided, and I was feeling amazing and preaching to the world.
How long had you had those symptoms? For years?
Years, 2 decades, yeah.
So, I see that. From time to time, people will come to my office having gone through all the specialists and they can't find the problem, and then all I do is take away the sugar and starch, use a keto diet, and they get better.
So simple. I went to so many doctors and they couldn't give me the answers. They did try to prescribe me like medications, but I don't want to take it, and I don't think it would have helped. It probably would have made things worse.
And so that is thought of as an inflammatory issue, which kind of goes in the big scheme of things that eating carbs, sugars, and starches are pro-inflammatory things to eat, and so you cut those out, and inflammation generally goes down. That's just an amazing
that's what
story.
happened with me. So yeah, I'm a good case study on that the power of nutrition to heal your body.
Excellent. Now, in your talk, at Adapt Minnesota, you talked about how to stay on it long term, or what kind of pointers were you thinking about as you put your talk
I just wanted
together?
to make it simple for people, because I deal in my practice. Most people come to me for low carb or keto, and so I'm experiencing it experiencing that on a day-to-day basis. So I try to take my top tips that really hit home with my clients and how to help them sustain this long term. So I try to condense them. I have a lot more tips and tricks under my belt, but I really just try to bring it down to the ones that would really hit home. Like keeping it simple. Like that's one of the number one things people do when they first hear keto is they really complicate it.
Yeah, there was a lot of confusion at the ADAPT meeting where people were worried about the macro levels and are they getting enough fat and that sort of thing. The simple message works pretty well for most people. Well, that's great. Thanks again for putting together the meeting. And if there's one thing you'd want to get across to people, the simple thing for people to learn, what would you tell people? To
cut sugar, and people don't even understand what that means. Like time after time, a new client will come to me and I'll ask them how much sugar they eat and they say none, and then I ask them about their breakfast and it's bananas, toast, jam, and cereal.
Sugar.
They're eating sugar. So you really need to look at the labels and maybe even just plug your food into an app. I'm not a big fan of using apps and gadgets, but it might be beneficial for the first couple days to see where your sugar and carbs is coming from, and so you can get your mind wrapped around that. And then don't fear fat. Eat some healthy fats.
Great. Thank you so much.
You're welcome.